Good afternoon. My name is Ashish Verma. I'm from Tata Consultancy Services, and I was heading this unique program to transform the way Cardinal Health was doing business in their nuclear pharmacy division. I have my co-speaker, Tim, who will introduce himself and probably browse through the initial part of the slides.
Okay. Hi, I'm Tim Cochran, Director of IT for our nuclear pharmacy division at Cardinal Health. You want me to do that? So, Cardinal Health, Fortune 21 company you've probably never heard of. We are located in Dublin, Ohio, do roughly about $108 billion, with a B, a year, and no one's really ever heard of us. So what do? We're kind of behind the scenes of healthcare, primarily in the pharmaceutical and the medical areas. We are the supply chain that gets all the medical and pharmaceutical products to eventually to the patient. So when you go to a pharmacy or you go to a hospital, a clinic, an ambulatory care center, Cardinal Health has more likely been there. Another part of Cardinal's umbrella is their nuclear pharmacy division. And that's what we'll be talking about today. So you ask, what is a nuclear pharmacy division? It provides the products at a patient dose level for folks that the most common one is for, say, a PET scan. So it is a scan. You are injected with a radionuclide. You get a scan to see if different organs or groups of organs in your body, how things are doing from either a diagnosis or a treatment perspective. And that's what we're going to be focusing on today. So what was the nuclear pharmacy challenge? So I'll be referencing NPS, Nuclear Pharmacy Services. For the past 15 years, each of 140 plus sites were running on what I would call a homegrown custom application, decentralized at each one of the sites, kind of a mini ERP. And what that meant essentially was it's a very manual process, and every process at 140 sites are all different, right? So that was the big challenge. You look at what they had to do, and it was really the day before, they look at the demand of what they're going to have for tomorrow. They would then generate all the scripts, all the packaging lists, all the packaging labels, all the Department of Transportation forms. And those would all go out on a huge table for that pharmacy for anywhere between 200 to 800 doses the next day. A lot of paper. And so as we all know, business is dynamic, right? So the pharmacists would then come in that next day. Their patients have been canceled. Maybe they have shifted or moved appointments, or hospitals have called in a bunch of stat orders. Things are dynamic. And they've been doing this for 15 years, right? So they got good at being able to shuffle the papers around and move things around, get things in. But it also meant that from a product perspective, this is product that has a short half-life of hours, sometimes minutes. So the pharmacists got really good at guessing, educated guesses, of what that demand would be the next day. But it wasn't always accurate. And so when you pull that material out of what's called a generator, if it's not used, it's bad and it's lost profit. So there's a lot of things we needed to fix there, let alone all the manual processes of all the paperwork and the costs centered around the paperwork. But also think about it, with all that paper going around, people can pick up the wrong form to the wrong package and possibly deliver the wrong doses to the wrong hospital. And if there's 6 doses in that given package to that hospital, that's 6 patients at whatever hospital that was supposed to be that didn't get their doses, and for that given hospital you showed up, those folks didn't get their doses either. So that's a pretty big impact from a customer standpoint too. So we focused on customer care. So that brings me to what we called our Fusion program, a true business transformational program. And I know that term is pretty cliche nowadays, but this truly was a business transformation at all aspects, from people, process, and technology. Obviously, technology played a huge piece of this. I would offer that the process changes were a bigger piece, as well as the people. Roles were changing. Some roles were going away. New roles were created. So it impacted all of the 3 ends of the triangle. Focusing on the technology piece of it from an SAP perspective, we really went at it going, we're going to use SAP. Why not SAP for all of this? And where we landed, to be quite honest with you, is because of some of the intricacies with the decay rate and the radioactivity material, we chose to do a front end that was not SAP, but that was linked, kind of bolted onto SAP, and call it a lot of the parameters, a lot of the APIs back in SAP. So we weren't recreating functionality, we're still using SAP's functionality. And then we used SAP as the core to provide what I would call the back office functionality, anywhere from billing and invoicing to pricing, materials, all the above. And then this also gave us an opportunity, of which we didn't have before, was a true data analytics environment. So we're capturing all this data now with this brand new system. Let's do something with this data. And so we have started this data analytics journey, if you will. Now on the bottom bullet there, you'll see master data. Never forget about master data, ever. That's hard. Yep.
So as Tim rightly mentioned, the product that we are dealing over here is very specialized in nature. It's high value. It's very short shelf life. As Tim was mentioning, it is few minutes, if not few hours. Right? So, and it's not just that it's a short shelf life. It is decaying over the period of time, whatever short shelf life it has. So it's like a melting ice cube, you know. So every minute, the cost changes, the price changes of the product. So it requires spatial handling of how this product needs to be handling from all the aspects, whether it is pricing, billing, whether the timing at what time the patient is going to get it, how much time is going to take to deliver to the patient. So all these aspects in terms of time played a crucial role. So it requires spatial handling, and hence we need to create a solution which was specialized in nature to deal with such kind of a complex product. Not only that, the generators that are used to create these doses for these patients has a special radioactivity terminology. So it's like the radioactivity goes up, then it goes down. So we need to find a right time when the generator has a certain amount of radioactivity to elute it, which means to extract the radioactivity out of it, and then make a dose out of it. So once the radioactivity goes down in the generator, it starts to come up again. It will not reach to the same level, but it will generate. It will increase the radioactivity again. So we need to kind of create a way in which we extract maximum radioactivity out of these radioactive generators, right? So because it's high value, that was special in it. So we created this solution into 4 different towers. What we said is the nuclear pharmacists that work in our nuclear pharmacy locations, they have a specialized job to do, right? So we need to use them in the appropriate fashion in their skill area. So we wanted to extract all the things which they do can be centralized and not really supposed to be done by nuclear pharmacists. So we extracted a lot of pricing functions, billing functions, account receivables, vendor contact, procurement, inventory management, account payables, all those kind of functions we extracted out of these radio pharmacists or nuclear pharmacists and create a centralized team of back office who is going to handle all these things for them, so in a centralized fashion. Then from the front-end side, it required spatial handling. As I was mentioning, we need to tell from which generator we need to get the radioactivity out of, right? So that we can maximize the utilization of the generators, of these high-value generators. So the functionality related to order management, order fulfillment, eluting, compounding, those kind of a functionality, we left it into our custom-based real-time front-end applications. Truly real-time. Previous processes, as Tim was mentioning, was more batch-oriented. Then, since this was touching with various, various different systems, their existing order entry systems, the legacy systems, because both applications has to live in parallel for some period of time. There was a lot of intricacies in terms of integrating these systems with the other systems. So, and there were several equipments and several hardware components, which like barcode scanners, mobile devices, touchscreen monitors, and dose calibrators. So a lot of integrations aspects was also creating the complexity around this solution. So for each of these interfaces, we did a deep dive sessions with our architects and various groups to identify how should we integrate these applications together. So a lot of effort went there. We created a specialized solution, a lot of integration touch points, complex architecture, but we used SAP heavily in terms of our back office operations. Procure to pay, order to cash, those kind of functionalities. When we were going through this journey, there was a lot of business challenges, there was a lot of IT challenges that we were getting. So one of the things was immediate availability of the distribution. So there is a patient who requires a drug, and suddenly we get a call from the hospital that we require this drug today. sometimes what happens is that these kind of generators won't be there to provide that kind of a radioactivity. So we need to do a special handling. We need to go to our next door pharmacies or nearby pharmacies, get the generators from there to our pharmacies. So stock transfer order capabilities we use to handle that kind of a challenge. Then the price changes for this radioactive materials is also handled through the specialized custom program that we wrote in ABAP. But only thing that we did over there is write the custom program for decaying the inventory and nothing else. Right? We used as much of standard SAP as we could, and I think we feel proud that we were able to restrain the number of customizations to less than 50 price objects. That was kind of a goal that we set for ourselves, and we kind of hit it. So great things there. Then also from customer credit point of view, when these doses gets delivered to the customers, there was in all of these customer negotiations, there was some amount of they can return the drug. They can return the dose for some percentage. So there was different percentages for different customers. So it required special handling of customer credits. So we wrote some specialized functions to handle that part also. Well, so as I mentioned, we implemented this complex business process using multiple technology stocks. So that was the challenges that we were facing. Also, the centralized implementation of business services using distributed clients. As I mentioned, there was interfaces with various other NPS enterprise applications that requires also a special handling. And not only that, means we are dealing in an area wherein orders has to be delivered in minutes, hours, things like that. So any kind of outages is not acceptable. So we created an offline solution. So just in case network goes down, some kind of a glitch happens, and we lose connectivity with our central server, functions has to happen. Right? So we created an offline solution to cater to the immediate needs, when the system could be down for 1 hour or half an hour or so. Then we wrote a complex custom program to execute credit calculation, as I was just mentioning. Then we also used Adobe Forms, which was greatly appreciated by our end customers as well in terms of invoicing, credit memos, debit memos, and so forth. Then there was almost 4 million pricing condition records for different levels of customer, whether it is GPOs or it is location or national. So those kind of a location, means those kind of a upload was also quite challenging for us to meet as a part of this journey. So some of the solutions that we implemented as to cater to those needs were centralized pharmacy management client for each of these pharmacy locations and the centralized server, back office. We used a geographical route tracking system using the mobile devices to optimize the route the drivers are using to deliver these doses to the patient. Also, not just that, these tablets were also used to capture the proof of delivery of these dosage delivery to the hospitals. Then non-core pharmacy operations were done in SAP software, as we mentioned. As Tim rightly mentioned, a lot of business analytics. We used an A to Z model to extract all the data out of these systems into a Teradata-based data warehouse to do specialized reporting to measure efficiencies across the process using SAP Business Objects. I think I'll hand it over to Tim to talk about the benefit that we received after implementing this program.
Okay. So from an SAP perspective, we were able to, I'm not going to read the slide, but we'll be able to be a lot more responsive to the customer. There's a lot of sticker credit controls that we're able to standardize. Not only that, but there's a lot of processes we standardize. There's a lot to be said for that. We also were able to centralize all of our billing and invoicing. They were all at the sites. We've then centralized that. It's one group doing it now. There's a lot of advantages to that. Improving the compliance on accounting. So I'm not an accountant. I'm not going to pretend to be one. But when you're dealing with product that decays so fast, there's a lot of accounting intricacies that come into play that were adjusted with this program. And of course, patient safety. So barcoding is nothing new. It's not new technology. However, the way we're able to use it and enable it throughout the entire cycle from procuring raw materials all the way through proof of delivery at a given customer site has made it, not only do we capture that data and understand that data better now, but from a patient safety perspective, it is increased immensely. I'm not going to drain this slide. We've already talked about a lot of the program benefits. I will note, though, when we signed up for this, the business case was about $19.2 million payback per year. It's pretty big. A lot of people say SAP projects, they're really expensive. We can't do this, can't afford it. Well, we signed up for $19.2 million per year. And so we're about 92, we're rolling out, we did not do Big Bang. We're rolling out about 6 sites per week. I think we're about 91 as of last night out of 140. And with a lot of the sites that went earlier in the year, we're already seeing this value coming back. It's not complete yet, obviously, but with our current predictions and analysis, we'll meet this $19.2 million per year. And optimistically, we're already seeing other advantages, especially through the data analysis, where we think we could actually commit to more than that. So just want to, it's important when you go through these type of things to make sure you have good value and you can defend it. Okay, so if you're the customer, so what? I want to be able to order my stuff easily. I want to be able to get my stuff when I wanted it. And I want to be able to pay it easily as well. So from a customer perspective on this program, we didn't really change the ordering process. They used pretty much the same channels, although we did streamline their web ordering. But we did make it easier so when they receive their product, one, they're getting the right product at the right place at the right time. But when they receive it, you'll note in the middle column, it says new label on the top of the pig. First off, we're not delivering farm animals to our customers, and we're not putting labels on those farm animals. A pig is a name of the tungsten and or lead container we put these syringes inside to prevent people from getting more exposure than they need. So because you can't see that syringe, we put labels on the tops of those, what we call pigs, so that when they do show up, they usually get anywhere between 2 to 6 at a given hospital site drop. They could see who the patient is for, which department it's supposed to go to, the timing of everything. It's all easily on a label on top of that pig, which makes it a lot easier. We've also enhanced their invoicing. So imagine we did billing at 140 sites and we did it all differently. It takes a lot to work with your customers to figure out what's the one format we can use across the entire organization. That was a lot of work, but we did come up with one. Customers seem to like it. We've streamlined it a great deal. We've added information, as well as we also made that invoice available on their web. So when they go to order in what we call web ordering, they're also now able to go get that invoice opposed to waiting for it in the mail or whatever avenue they have chosen. Again, and that is done through SAP. And at the end, we've also, while we don't have any good examples yet, we are starting to work with our customers now in regards to this data that we are collecting, in regards to how many scans of what product they have done in the last month, the last 3 months, the last year, what doctor's prescribing the most here or there. If you're an IDN at a large hospital chain, you want to know that type of information, and we're right at the cusp to be able to start providing that extra added value, if you will, to our customer. With that, I'd like to say thank you. Appreciate it. If you have any questions, we will be in the back. I also want to give a big thanks to Tata Consulting Services. I will tell you, from my experience, top-notch consulting team. We could not have done it without them.
Thank you, Tim.